I'm Bill the Geek, broadcasting not live from Chapala, Mexico. We make videos about Mexico. We travel Mexico, we go to cities, we go to towns. We go to points of entrance, we go to Mexican restaurants, we interview immigration attorneys, health officials, and we try to give you information about living in and moving to Mexico. I'm Bill Dallas Lewis, and this is the Bill Dallas Lewis channel. This video is about health care for Americans in Mexico. This video is about medical care for Americans in Mexico. This video is about Living Will, Mexico. This video is about medical directives. This is part 2 of a health series, and we wanted to break it into 2 parts. In part 1, we specifically talk about setting up your living will, setting up your medical directive, because you want to think about what happens if you pass out in Walmart and nobody knows who you are or what hospitals you need to go to. What if you get hit by a car? What if a building falls down on you? Who should people contact? So in part 1, we go through the specifics of setting up a medical directive, and we go specifically into, do you need to talk to an attorney, a notario publico, or what? In this part, we want to talk more about doctors, medical law in Mexico, which is different than medical law in the United States, and we want to talk about banking laws. So you really want to watch part 1. There's a link to part 1. It's a 16-minute video, but the link is in the description below. You want to watch that video. In this video, we're going to talk about what are the rights of a patient. What are the responsibilities in Mexico for doctors? What are Mexican laws that can help you or can hurt you in a medical emergency? And we're going to walk you through banking laws that apply to all banks in Mexico should you die. In part 1, we go through the specifics of how this video came to be. For people that already saw part 1, I don't want to go through that totally again, so watch part 1. But a couple of catastrophes happened to people that I know in my life, and something happened here in Ajijic, and Annette Williams thought it was important enough to bring together a group of doctors, attorneys, notaries from Mexico that are different than notaries in the United States, and they made a 2-hour presentation. So this is the second part of the presentation that came from a doctor at San Antonio Hospital on what he runs into regularly in medical emergencies and the challenges that he faces every day when Americans come into his hospital unconscious. And of course, I want to make a disclaimer statement. I'm not a doctor, I'm not a lawyer, I'm not a Mexican notary. These are just notes that I took in a 2-hour presentation that I thought could help you out. As you move ahead in your legal decisions and your medical decisions, you want to specifically talk to a Mexican notary, a Mexican attorney, and a Mexican doctor. You got to do that to make sure all your bases are covered. In part 1, we talk about the Red Cross. And the Red Cross in Mexico, specifically in the Chapala, Ajijic area, that is the ambulance service. They have paramedics there. I've had an emergency when I've gone to the Red Cross. They're only like a half mile away, and they've helped me out with no charge. But if you need an ambulance in the Chapala, Ajijic area, pretty much you're going to depend upon the Red Cross. And also in part 1, we talk about these little emergency kits that they give you. You really need to check out part 1 to see what this is all about. In here, these things cost $3.50. They have papers in here on, you fill them out, like what is your blood type, what hospital do you want to go to, you put your medical directive in here. There's a magnet in here, you put the magnet on your refrigerator. And if the Red Cross comes to your house, they come into your house, they're trained to look on your refrigerator to see if you have a Red Cross magnet. If you have a Red Cross magnet, they look in your refrigerator, look in the kit, and they take you to your preferred hospital. So, but anyway, the Red Cross will take you to whatever hospital you want to go to within reason. But there are only like 3 good private hospitals in the Chapala Ahihic area, and each of them have different forms of equipment to treat different medical emergencies. So the Red Cross is kind of in a dilemma. You may want them to take you to a hospital in Guadalajara, okay? But Guadalajara on a good day is 45 minutes away. On a bad day, it can take 5 to 8 hours to get to Guadalajara. The Red Cross ambulance people have to make a decision. If they think you're going to die in about half an hour to 45 minutes, and you want to go to a hospital in Guadalajara, they're not going to do that because that would be against Mexican law. Mexican law says that they have to save your life. So they may have to take you to a private hospital closer than Guadalajara. And doctors are kind of in a similar situation. But the ambulance drivers at Red Cross, this doctor, I'm getting all of these comments from a doctor at San Antonio Hospital near Ajijic, and he's saying that these are all well-trained paramedics and they will make a good decision. But the ambulance will take you wherever you want to go. The thing is, with the ambulance, they may want to charge you 3,000 to 5,000 pesos. Okay, 3,000 to 5,000 pesos, that's like $150 or $250. And you can, if you don't have the money with you at the time, you can tell them, hey, can I pay you later? And they will do that. Hopefully they will, but they have done it in the past. But they will charge you a fee. You won't have to pay them right then, and they will take you wherever you want to go. Now, doctors in Mexico are in the same situation as the Red Cross. Mexican law says doctors have to help you live and help you keep alive. But one doctor's idea on how to keep you alive and another doctor's idea of how to keep you alive and your idea of how to keep you alive may all be different things. Mosquitoes are bad out here. But that's why this doctor from San Antonio Hospital says you need to be very specific in your medical directive, in your living will. You need to state, do not put tubes in me. If you don't want tubes in you, don't have them put in. You can write that in. Or you can say in your medical directive, if I'm unconscious for like 3 days, do not do anything, unplug all the stuff. Imagine you're in a coma for like 6 months and you wake up and you owe the hospital like $10 million, okay? So in your medical directive, you can say after 1 day in a coma, 2 days in a coma, 4 days of unconsciousness, just give up, turn off all the stuff. But this doctor from San Antonio, he's saying you have to be very specific. And in part 1, we talk about choosing a doctor, choosing a lawyer, making sure that these people are on the same page as you are as far as what you want to have done in your emergency situation. But by law, doctors in Mexico have to keep you alive. So if you're in a coma and they put tubes in you to keep you alive, well, they can't pull them out, because if they pull the tubes out, Mexican law would say, well, you didn't help this person live. So in your medical directive, you have to say, okay, don't put tubes in me, or you have to say specifically, if the tubes aren't working after like 2 days, pull the tubes out. or they have to leave them in there forever. But this doctor from San Antonio Hospital is saying be as specific as you can in your medical directive and tell the people that are close to you everything that you want to have done in a medical emergency, and you want to have this all written out specifically in your living will, your medical directory. Hey, tell us what you think. Leave a comment. What didn't we say? What should we say? What more do you want to know about? Just please leave a comment. Does a private hospital have to take you? The answer is yes. A private hospital must admit you and take care of the initial parts of your medical emergency. But once they take care of the initial part, then you most likely you're going to need a day or two, maybe a week, 2 weeks of further care. So they can take care of your initial medical emergency, but then you're going to have to stay there and get additional care, which is going to cost money. So after they take care of your initial treatment, then you're going to have to be responsible to pay them, and most likely you're going to have to pay them up front, or they won't do anything. If you decide not to pay them, then they're going to send you to a public hospital. And a public hospital, I've been to a public hospital. I'm not going back. I have health insurance. I only go to private hospitals if necessary. They're very nice. But if you go to a public hospital, the service may not be good. You have to go with your own nurse or someone that can be there with you all the time to do things that a nurse would usually do. So you really don't want to be in that situation. But a private hospital does have to take you, but if you can't pay, they will release you and send you somewhere else. And in an emergency, that's not a good thing, because at the private hospital, they have one person at the private hospital that is only responsible for looking around for public hospitals and understanding what public hospital can do what, which one is available at the time to help you. And so you're having a medical emergency, and these people are on the phone. Okay, when can he come? Can he come like this afternoon, tonight, tomorrow? Can he come Wednesday? Okay, so that's the deal. So if you don't have the money, you're going to be in bad shape. We go live every Saturday morning at 10 a.m. Central Time, that's Chicago time, Houston time, and we have a bunch of people from around the world, and we talk about where we want to live in Mexico, and we talk about living in Mexico. We go an hour and a half, 2 hours, we might go 3 sometimes. So you want to be sure to subscribe so that whenever we go live Saturday at 10 a.m., you get a notice and you can put it on your calendar. Join us, please. Also, this doctor from San Antonio Hospital stated that people show up in his hospital all the time unconscious, and they don't have any papers on them. They don't know what to do with them. They don't have any medical history on them. He says it happens all the time. You don't want to be in that situation. That's why you really want to watch part 1 of this series. The link is in the description below, and you want to really look into this $3.50 Red Cross jar. The doctor went into specifics about healthcare cost for 2 items that he sees all the time. One was a heart attack. Let me look at my figures over here. He said that a heart attack is going to cost you about 150,000 Mexican pesos, which is about $8,000 United States dollars. He said COVID is going to cost you about $100,000. That's approximately 100,000 pesos. That's about 5,000 US dollars. He said COVID with tubes is going to cost you about 150,000 pesos. That's about $8,000. He said COVID with tubes cannot be treated in the Chapala, Ajijic area, so they will have to send you to Guadalajara for that. But those are two regular issues he's running into all of the time down here: COVID with tubes, and heart attacks, and those are the associated cost. The doctor added that hospitals do take U.S. credit cards and they do take PayPal. In part 1 of this series, the link is below in the description below, but you really need to shop your hospitals, because he says different hospitals in the area have different equipment. And he said that at the San Antonio hospital, they have an MRI machine which can analyze stroke, and it can get the results back in like 20 minutes. He said that San Nicolas Hospital has a CAT scan machine, and that can analyze stroke in about 15 minutes. That's why it's important to shop hospitals while you're healthy. When you don't have anything to do, go visit them. Take a copy of your medical directory and give it to them so that they have it on record, so that when you show up, they know your blood type, they know everything about you when you show up unconscious, half dead. This doctor says if an ambulance takes you to a public hospital, the public hospital will not accept you. Now, I don't understand that, but that's what he said. What he said was, first you have to go to a private hospital, and then the private hospital will send you to a public hospital. Go visit the hospitals and ask them. I didn't understand that at all. Now we want to switch over to banking and the laws in Mexican banks about your money. In Mexico, you can have 6 beneficiaries. It doesn't matter who they are. They can be family, friends, the neighbor next door, your landlord, your attorney, whoever you want it to be, but you can have 6 of them. In Mexico, if you put money in a Mexican bank, after 3 years, you have to do something with the money. Yeah, you have to take some out, put some in. You have to do something with the money. If you don't do anything with the money, I don't know what they do. Your beneficiaries have 6 years to collect the money, to collect your money should you go on to that other universe. If they don't collect this money in 6 years, then your money goes into a global fund, the banker. This is coming directly from the mouth of a banker. Your money goes into a global fund, and so that's like it's gone, okay? I don't know how that works. I wonder if all the banks put their money into one global fund or whatever, but after 6 years, your money is gone. The banker also said that you can have a person who has a co-signer position to your bank account. That means they have equal powers to your Mexican bank account as you do, which is kind of important, because if you're in a coma and you need some special work done and you've been in a coma for 3 days, somebody's got to be able to contact your bank and get that money for you. So this banker said you can have a person who has equal signing authority to you with your bank account. Now, I'm not sure what part of the presentation this came up in, but the banker said there are 3 types of insurance everyone should have. Everyone should have homeowners insurance, if appropriate. Everyone should have renters insurance, if appropriate. And everyone should have burial insurance, if appropriate. Teresa, my wife, and I, we just got burial insurance, about 2 months ago. It's very inexpensive. It's like $100 a year. You have to pay it every year, but we're both going to get cremated. So if we go to the other universe like this afternoon, then everything's paid for. So, but those are 3 types of insurance the banker said everyone should have. Thank you for watching. We hope the information is helping you out. We have many more videos to come, so hit the subscribe button and don't miss a thing.